our next speaker is from one of our sponsors, Pfizer, and she's going to speak to us about the psychological aspects of patients with metastatic breast cancer. So Hannah Stomaeus is going to present next.
I can hold it.
Okay.
Okay, thank you.
Okay, thank you very much.
So, thank you very much, and thanks a lot to the organizing committee for inviting me to this special event. And I'm very happy and honored to be here at the first European Oncology Nursing Day. And I'm a nurse myself. I used to work in oncology and hematology unit back in Sweden, although I counted now it is 20 years ago, in fact, so maybe it's not so relevant, but so this forum feels quite at home for me. Today I'm working at Pfizer. Perhaps some of you know it's a worldwide pharmaceutical company with the ambition to redefine life with cancer. We have a strong commitment in research and development, and the portfolio addresses different medicines within various cancer types, breast cancer, lung cancer, renal, and hematological malignancies. Beyond that, we are having many valuable collaboration partnership with academia, with healthcare, society, and patient advocacy. And I'm actually here today to speak around one initiative in Sweden, together with patient advocacy. Metastatic breast cancer patients have long been treated as forgotten heroes. Forgotten by the research community, by the media, and even by the advocacy world and their fellow breast cancer patients with early disease. Everyone prefers a story with a happy ending, and the fertility burden associated with metastatic breast cancer is often too hard to deal with. It touches the profound human fears of suffering and mortality. This is a quote by Fatima Cardoso. Maybe you're familiar with her. She's director of the breast cancer unit in Lisbon, Portugal. She's also in the committee for ABC Consensus Congress for Breast Cancer, as well as the chair for the Global Decade Report, which I will refer to in this presentation. The 5-year survival rate reaches nearly 90% for patients with early breast cancer, but it amounts only to 25% for patients with metastatic breast cancer. I don't know, how many of you work with breast cancer in your daily work? There are a few of you. Okay, perfect. And here are some wordings that are on patient's mind living with metastatic breast cancer. We see depression, we see fear, anxiety. And what do we know about the patient, or majority of them are women? Well, patients globally face stigma and isolation from their communities when they're diagnosed with metastatic breast cancer. They don't reckon the picture we see sometimes with the pink flowers and what we do in campaigns. Now, the diagnosis of metastatic breast cancer represents a time of shock, of course, crisis, and anxiety for patients and their families. And 8 out of 10 women feel that quality of life is the biggest area in need of improvement in metastatic breast cancer. And access to wider and individualized support services is important to patients with metastatic breast cancer along their treatment continuum, not only in the very ending, as we heard earlier, in the palliative ending. Many women don't talk about their disease, and their overall knowledge in society is poor. In a survey, 44% of respondents reported being afraid to talk openly about the disease, and more than half of the patients said their friends and family were uneasy talking about the disease. And the majority also believe that metastatic breast cancer receives very little public attention compared to early breast cancer. So they feel sort of forgotten. And to get the women to talk, share their stories, and empower them, we need to start listening and highlighting their disease. And therefore, we initiated a collaboration with the Breast Cancer Association, the Patient Association. As a start, we conducted focus group meetings, one with women living with a disease and one with their relatives. And the result of these focus group meetings confirmed the big global decade report. So the women expressed, as you can see here, some quotes, that they suffer from great pain and fatigue and feel that the disease is limiting to their lives. They live in cycles of 3 months. It's hard because you can't make any plans. They feel that their relatives are worried and feel powerless. Sometimes you don't want to talk to your relatives. You just need to take responsibility for your own anxiety. Their children, because this affects women, right, in early ages also, and their children didn't get the same amount of support as their husbands. So the children are forgotten. How can I explain, how can I talk to my small children? And it's hard to know your rights. In Sweden right now, it's quite a big debate around a patient act, a patient law that was introduced a couple of years ago to support the patient and their rights. And you can see that there are a lot of gaps in supporting these women because they don't know, the patient don't know the rights. And the husband expressed that they experience a huge amount of limits in life and feel it's impossible to talk about the future. And the relative perspective is crucial. So what were their expressed needs? To be made visible and be taken seriously by society and the care. And to increase the knowledge, because that's where it starts, right? Politicians and stakeholders need to increase their awareness of this disease. Better quality of life, better care, continuing rehabilitation, better psychosocial support to both patients and relatives, of course, throughout the entire disease period, not only in the final palliative care as it is today. We know that with the development, with new medication and new developed care, they live longer today. Many people live for many, many years, and they should cope with this situation. So even though the 5-year survival rate in metastatic breast cancer is only 25%, many patients live longer today. And as more and more women live longer with the metastatic disease, offering informational resources for this population is increasingly important. And we asked the patients, is it okay to talk directly with and about women with metastatic breast cancer in a harsh and unflattering manner? Not with a pink flavor. And the answer was yes. And therefore, we could launch this project in Swedish called Ospridd sanning. It doesn't make sense to you, only to Lina and myself, but if I should try to translate it. So, unscattered truth. Scattered is in Swedish spridd, and the word is used for metastatic disease. So we're talking about the unspread or unscattered truth around spread disease. And this is a project run by the Swedish Breast Cancer Association with the engagement of patients. And it addresses the decision makers directly. And it consists of a website, online and offline activities, activities on social media, and the campaign on the site or the focus, the themes, are decided by women themselves in the focus groups. And the first theme that was of the greatest importance for the patients when we did this half a year ago was psychosocial support. That was on top of their mind and of their importance, of great importance. So that's the campaign that is running right now under the project Unscattered Truth. And the next one is around research and new treatments. So the purpose of this project is really to create an engagement. Of course, increase knowledge, but create an engagement among politicians and stakeholders to make life better for women with metastatic breast cancer. So our priority was to ensure that patients and relatives receive the support they need throughout the whole disease period. And the goal is to increase the knowledge and get better care for patients. So this is a screenshot of the site. It was launched about a month ago, so it's quite newly launched. And as you can see, it's not a traditional site where you just go in and read, but you should actually act. That's what we want the politicians to do, right? Not only talk, but act. So here they can sign up if they'd like to know more, if they want to dialogue with us and contribute to the change for these women. And I talked to the technical or the technical guy at the agency, and as of today, it's more than 8,000 people spreading the site or sharing the site, and more than 1,000 people that have been signing up, and many of them are politicians and stakeholders. So the heart of the project is the site, because that's a landing platform where we share the patient stories to create an engagement, but we're also advertising in channels where we know that politicians are visible. And we communicate with them through emails. And we're advertising on social media, Instagram, Facebook. And last week, there was a patient living with metastatic disease and a Swedish oncologist talking around psychosocial support and where there are gaps today and what needs to be done. So it's for sure a great engagement around this topic. And for me, working in a pharmaceutical company, I truly believe in medicines, of course, but there are far more to do beyond the pill, so to speak, like these initiatives and the work that you're doing every day. So you're really making a big difference in your daily work, I would say. So I think that was it. Thank you.
Has anybody got any questions for Hannah? Yeah, go on, Eric.
Thank you very much for sharing. Yeah. I had I saw something standing in your slides that 25% of these women are survivors in 5 years. I thought it was already higher due to the new medication.
Not the survival rate.
Oh, not the survival rate.
Not the survival rate.
Okay.
Yeah.
And okay, then I have that. That's I thought so. But and then something else. Last year I chaired in October, in the pink month, I should say, a group with partners from metastatic breast cancer patients, and those partners were very struggling. That were mainly men with their partners, because a lot of metastasized patients find it horrible that October month, because they're so not recognized, and everybody has to be happy, and all those glossies coming out, and celebrities say, "Oh, I've got my mastectomy done, and now I'm healed." And that, we had it was a workshop, so we talked about the item, how you're dealing with a woman who's almost depressed in that month, due to what's happening in the media. But so I totally understand what you're saying here. So
Yeah, correct. I mean, that's what we found out to interviewing these women, that they don't recognize that image overall. No.
And I've just got one question, Hannah. Did you survey staff at all, or staff that work with people with metastatic breast cancer?
Sorry.
Did you survey staff, or did you talk to staff at all? Or is there any work that you've done particularly?
No, only patients.
Okay.
Only patients and their needs. No staff, no.
Yeah. So we did a study a number of years ago, and we found that our outpatient staff were in tune with what was happening to women with metastatic breast cancer. So they were cognizant of the fact that people live 5, 10, 15 years with metastatic breast cancer. But the inpatient nurses hadn't had a complete mismatch in a way from their knowledge. So because they only saw the patients when they were in trouble, so when they were really sick, and those episodes within somebody with metastatic disease life where they're very sick, they couldn't really see why we were treating people for 5 and 10 years with metastatic disease. So it was a really interesting output. And of course, what we needed to do was put some education in. And we also encouraged patients to go up to the wards to say hello to people when they came in for their outpatients. So then the inpatient nurses got more of an idea that people lived with metastatic breast cancer for a long time, not just sort of dying with metastatic breast cancer. It was a really interesting project. Okay, thank you very much. Thank you.
I have one more comment, sorry. I totally recognize what you're saying. When in the Stone Age, when I was working in inpatient care, I thought that everybody died within weeks after treatment, because that's the only thing you saw. So, yeah. But I wonder also, what kind of reactions have you had? I mean, it's great what you say about the patients. I understand that. But how does society react? Or have you had any other reactions from others than patients to this project?
Yes, so like it's quite newly launched. It's only a month ago, so we haven't got so many reactions, more than actions, I would say. So we're now collecting all the people that have signed up to know more, and sort of collecting stories of patients, and also. Since the site or the project is we want them to act, right? So what we've done on the site is to visualize around now the first theme around psychosocial support, given examples of centers in Sweden that are working very well in this perspective and with good examples, and some councils that are not working that well. But so of course, with politicians, they can never promise anything, but they can look at the good examples and work in their own district. So that's what we are, we're going to follow up with them continuously. So, yeah. Thank you.
Okay, thank you, Hannah. Thank you very much.